得。我哋而家足夠即係法定人。
We formed a quorum. May I call the meeting to order? Please invite the administration to join us now.
有嘅。
跟埋你。
係啦，係啦。
其實梁家傑喺隔離開。
我知，可能佢一陣會過嚟。有冇整嗰啲廣告啊？唔係，如果唔係我都熟㗎啦，我就唔好漏嘢咁解。好，歡迎政府嘅同。
Welcome, representatives from the administration.
表達意見嘅團體同埋個人呢，就。
I must apologize to the individuals and organizations who are here this morning. We gave you short notice because the first meeting was only held last Monday. Because of filibustering in the council, the slots available are really not that many. So we gave you very short notice for this morning, and perhaps you haven't been given a lot of time to prepare for this open hearing. All right. Can I invite the administration to brief us on the notice, and then we'll give the floor to deputations. Commissioner. Thank you, Chairman. You may recall that on the 18th of November 2011, the RCH Persons with Disabilities Ordinance came into operation. However, the sanctions were not yet effective yet, because we wanted to give a grace period of 18 months for the relevant institutions to have the time to deal with their licensing application, and the grace period will expire in May this year. So we have given a commencement notice. On the 10th of June this year, there will be full implementation of the licensing scheme. After that date, any institution that is in operation without a certificate of exemption or license will be fined and prosecuted. So that's the purpose of the notice. Perhaps I pause here, and then after hearing from the deputations and members of the subcommittee, we will respond. Thank you, Commissioner. And I'll give the floor to individuals and deputations. I'd like to remind you that you may wear the EPs to for reception 01 channel 1 floor. Channel 0 floor, channel 1 Cantonese, channel 2 English. Please be reminded your speeches will not be protected by Cap 328, Electrical Powers and Privileges Ordinance, so you have to be liable and responsible for your own remarks. Okay, the first deputation is Association of Hong Kong Nursing Staff and Mr. Liu Yuhang, Executive Officer. Oh, I beg your pardon. Each deputation or individual will have 3 minutes to speak. Mr. Liu. Thank you, Chairman. On behalf of the Association of Hong Kong Nursing Staff, I'm very pleased that I'm able to present our views this morning. First, I like to provide some statistics in relation to manning situation of RCHDs, and I would also like to tell you our views about the implementation of the ordinance, and then some suggestions from us. Well, we did nursing manpower resource survey last year, and it's found that the wastage rate rate was very high. Using Institute for the Ex-Mentally Ill as an example, 95.7% of the respondents revealed that they were not able to fill vacancies in the past 6 months. That is 32.2%. This is much higher than the average for other homes, which stood at 32.3%. The situation is very bad. And then for the morale of nurses working in such institutes is also not very satisfactory. For giving a full mark of 10 for nurses working in ordinary rehabilitation homes, 5.76, and then for those working in institutes for the ex-mental ill, 7%. That's the pressure score. Is much higher than the overall average of 6.8 in other homes. And the implications of the ordinance. It's true that the ordinance has helped institutes to employ nurses to take care of inmates, because for every 60 inmates, there should be 2 health workers or 1 nurse. So institutes have been encouraged to employ more nurses. However, in the long term, we have the following suggestions so as to further improve the nursing manpower situation and training of RCHDs. First, the lump sum grant mechanism should be fine-tuned, because the current mechanism may not allow sufficient resources for RCHDs to retain manpower. So there should be dedicated funds for employment of nurses. In the long term, there must be a planning for nursing staff so as to retain experienced nurses and to enhance the quality of care in RCHDs. And in-service training should also be provided for such nurses. Thank you. When we have time left, Mr. Liu, you can supplement. Thank you. Next, Mr. Lee Chi-yong, Chairman of the Association of Parents of the Severely Mentally Handicapped. Good morning. The association could see from the government's paper that the board place scheme will be able to shorten the waiting time and also to afford more choices for service for the clients. However, this is just an expedient arrangement to solve the problem. There should be more government homes or public homes. Now, according to the government, to the paper, there are 362 institutes with a certificate of exemption, and some say, the government say that another grace period of 12 months should be granted for these institutions to improve. But we believe a grace period of 18 months is already enough. And then the wages. Using the enrolled nurse training courses of the SWT as an example, well, the salary and fringe benefits are not interesting enough to attract nurses. After these trainees have completed 2 years of service after graduation, they will join the private sector. So how will the administration really face up to this problem and find a long-term solution? To ensure that private homes can meet the requirements, the space requirement has been reduced to 6.5 square meters. That means that 71 square feet is for one POW. In fact, there is not much living space for them, and I think the area should be raised to 8 square meters per person. And then there is no age limit for inmates in these homes. We believe that for children, for school children, the hostels should be provided by schools. And the administration claims that if you have a joint board place scheme home, then you have given up your placed on the waiting list. But we believe this is not good because because we've seen cases where applicants have been rejected after they have accepted a BHS place. Now there is a quality service working group to visit RCHDs, but in fact all the inspections are done with advance notice, and they may not be able to find out the real picture. Thank you. Mr. Liu Wing-Yu, Chairman of the Hong Kong Private Hostel for Rehabilitation Association. Thank you. In the legislative process, our association has told you our difficulties. Let me tell you how we feel about the whole legislation. Well, we've been forced into a corner by the administration so that there is no room for us to maneuver. But when we are cornered, well, we can always hit back. Or, well, the administration or the SWD pull us out of that corner. Now, what I find what's behind me is not a corner, but a cliff. A few steps more, I will fall to my death from this cliff. We have no objection to having legislation. We agree to improvements for our CHDs. So we have invested a lot into our hostels, and we have to incur more costs. Where can we find the resources? Because we charge our inmates the same rate. Given the CSSA limits, we cannot raise the fees. And where can we find the resources? Last month at the Welfare Services panel meeting, we all referred to one problem. How come so many RCHDs cannot be licensed? Because they have to spend extra resources to improve the infrastructure, and our recurrent operating cost is also a problem. If you take a look at the Certificate of Exemption, COE, most RCHDs must reduce the number of places, because we started with about 4 square meters per person, but now it is increased to 6.5 square meters. Housing is a major problem in Hong Kong, and we are really under pressure from our landlords. So you have never see things from our shoes. And then I think there is only one way out. We close down and go bankrupt.
Well, last time members said that they didn't really believe in the figures provided by the SWDs. Yeah, that's true. I don't quite believe it. I think at least 1/3 of the RCHDs would have to fold. I'm not trying to threaten you. This is the real situation. So I hope that members can all look into this issue today. Thank you, Mr. Lee. Next, Hong Kong Council of Social Service, Chief Officer Rehabilitation Service, Mr. Kwok-che. Well, we have always been advocating legislation so that RCHD's quality can be improved, and we have the following concerns. Now, when we look at the electoral paper, actually there are still 34 institutions that still have not got the license or certificate of exemption, and then the law will come into operation on the 10th of June. So what will happen to them? Now, for the 316 RCHDs, 262 of them have already got a license or got COE, but they haven't got a real formal license. I think the progress is really slow. I have contacted many NGOs and RCHD operators. They told me that in the course of application, they encountered a lot of problems, in particular when it comes to fire safety, etc. So for these RCHD operators, they may not have thorough knowledge of the whole application procedures. Now they may have to make renovations to their homes, and then they ask the government to come to inspect them, and then they have to make further improvements, and also they have to hire architects to make changes to the layout plans, etc. So they encounter a lot of difficulties in the course. As for the licensing office of the SWD has been providing support to the NGOs, but we think that this support has to be enhanced, and there should be more communications with the NGOs. And also, we are also very concerned about this because for subvented RCHDs, they may be in old premises, and if they have to make changes to hardwares, it's very difficult. So what will happen to them? So will the exemption be extended forever? And also, there are 7 institutions that have not applied for a license, and many private RCHDs may eventually be unable to get a license. So we are very concerned about what will happen to the residents. So we hope that SWD will take an active role and provide appropriate support to these residents so that they can be relocated appropriately. And also for RCHD service, I think there is a huge demand for it. In 2007, there was an RPP, and it proposed a 3-pronged support. That is for subvented, self-financing, and private RCHDs. They should all be providing this kind of service. So for self-financing and private RCHDs, how can we be sure that they can provide quality service? This is something we are very concerned about. Next, Hong Kong Private RCHD Association, Ms. Ng Yue Yi. I'm happy that a lot of RCHDs are providing higher quality services now, but I would like to make some suggestions. Now, many mental patients are now living in RCHDs. And for health workers who are working in RCHEs, they would have to take courses in order to provide service. So I think more courses of this kind should be provided so that service qualities of institutions can be enhanced. Thank you. Next, Tonghua Association for the Gifted Child Limited, CEO Mr. Lee Pak-ying. I hope that the government can successfully register all RCHDs so that RCHDs can make a reasonable profits. Now, actually, the government, through this licensing scheme, hopes to enhance the service quality of RCHDs, and it wants the RCHDs or the existing RCHDs to continue their operations. However, there have been a lot of obstacles, and it's very difficult for us to continue to operate. And I think the government should provide exemptions to RCHDs, those which have been operating before the enactment of this piece of legislation. That is the 18th of November 2011. And also when institutions are operated in certain communities, they may see a lot of resistance among the residents. Actually, we have been operating in these communities for quite some time, and now because we have been putting up notices, so that this has aroused the residents' attentions, and now they are objecting to our existence. So we have to go to a lot of government departments to solve this problem. It may take us 6 months or even a longer period to solve the problem. Actually, we have been coexisting for such a long time. Before the legislation, we have already been operating there. So I think exemption should be given to us. And also, when it comes to law enforcement, there is a lack of flexibility. Yes, we understand that health workers should be trained so as to be qualified for serving our CHDs or for serving in our CHDs. And also, the Nurse Association of Hong Kong nursing staff told us that there is a huge shortage of manpower. So we would only be too happy if people are willing to work for us. So you should give time to these people so that these health workers can receive training. And also the government should provide more training opportunities because sometimes it's very difficult to get a place in a training course. And also rehabilitation and care coupons should be provided. This should be replacing the CSSAs. Now CSSA is to help low-income people. It's not to help inmates of RCHDs. So if you have this kind of care coupons, I'm sure the sector's service quality would be enhanced. Thank you, Mr. Lee. Next, Fourth Right Caucus, Ms. Ho Ping Ching. For this piece of legislation, actually, its intent was good. Because for private RCHDs, their service quality may vary a lot. Now, a lot of NGOs have been making a lot of effort. Now we are having this piece of legislation. Now, in the January paper, it stated that, well, there were 11 institutions that might not be able to get the license because of the limitations in their premises, and over 200 of the inmates would have to be displaced. And now 7 institutions have not applied for a license, and they may have to fold. So I think the SWD should provide appropriate support to the inmates. And also, the operator would only have to give 1 month's notice to the inmates before it folds. And that is too rushed. We think that should be extended to 3 months. And also, for the area for per inmate, we also are very concerned. And for private RCHDs, it is quite difficult because their premises would always be quite small. So for suspended RCHDs, and private RCHDs, they may be facing different situations. So I hope the government would look at this again, because for suspended RCHDs, I think you have not been too stringent. But for private RCHDs, there are too many limitations. So there should be a more level playing field. And also, I think the government should be more prudent. Now, you are launching this piece of legislation because you want to enhance service quality. So for the certificate of exemption, I think you should be very prudent about it. Don't just give it to anyone. And also for now there are some handicapped children who may stay in our CHD for a short period of time if their carers have some problems. But this kind of arrangement will terminate in a short while, and so they may have to resort to private RCHDs. So for this kind of service they are providing to children between the age of 6 to 14, you cannot stop this kind of service. You have to provide resources to these children. And also for private RCHDs, we don't agree that children between the age of 6 and 14 who have disabilities will be put in private RCHDs. I think private RCHD should only house adult people. Next, Mr. Pong Kwok-che. Well, members of the industry have said that, well, before the termination of the exemption period, some institutions will find themselves unable to be qualified. Well, for many NGOs, when they operate RCHDs, they have a lot of problems. For example, they cannot improve their hardwares. and the rents may be too high, and because of the new statutory minimum wage, etc. So they may not be able to continue to operate. So for private RCHTs, we are facing a lot of problems like this. We really cannot be qualified for the license. Now, even though now we have a COE, we may not be able to get a license in the future. Because after obtaining the COE, we still have to make improvements to our premises, and we have to talk to the landlord about rental level, etc. So there are a lot of question marks. So in the future, for our CHDs with COEs, they may not be able to get a license eventually. So I hope that the government can give us more support, no matter whether it's financially or in terms of premises. Thank you. Next, for Hangziga, Mr. Lamaukai. Thank you. I would like to make 2 points, Chairman. I myself am a member of a private association for PWDs. We agree to the legislation because we think that it will help a lot of people. However, there are a lot of problems. We know that legislation is good, but when we operate a private RCHD, we encounter a lot of problems. Now, how come so many of institutions are unable to get a COE or a license? It is because there are real difficulties for them. Now, we think that at least 1/3 of the institutions would have to fold when this licensing scheme takes effect. So where can the inmates go? We really do not know. This is a serious problem. And I have 2 problems. Now, first of all, about town planning. Just now, Mr. Lee has pointed this out already. Now, why is there a problem with town planning? Now, there are 2 elements involved. First, well, this is an institution for residential purpose, and also it provides social service. So we have to apply to the town planning board, and if there are objections in the community, it's very difficult for us to get a green light. So we have talked to the SWD. Now, I hope that SWD can give us more assistance. This problem must be resolved. And second, for improvement works. Now, for some institutions, if they are lucky, then they can be qualified. Now, for me, I have encountered a lot of problems. Maybe it's just a difference of 2 inches, and I have to hire contractors to make improvements, and that may cost up to $1 million. So I can apply for a subsidy, and what if I get $600,000? And that's public money. I'm using this $600,000 which come from the taxpayers, and I'm just to improve a space of 2 inches. I don't think public money should be spent like that. Now, we're talking about very minor problems, and a huge sum of money would have to be spent on it. Now, if that small improvement costs me $600,000, maybe the government can just give me $200,000 and I can move to another place. Thank you. Mr. Chan Kim-hwa.
Good morning, Chairman and members. The spate of closures of private homes. I have got a private home who is closing. Perhaps you'd like to know the reasons. Why do I have to close my private home? Because there are about 20 places admitting smarter ex-mental patients. Well, daytime they go to work or attend day hospitals for training. So during daytime, there is no one. In my RCHD, they come back in the evening for medication, for meals, and we have staff members to chat with them. So it's a very cozy, family-like environment. But with the enactment of the legislation, this can no longer be the place, because you look at that menu for RCHDs with less than 40 inmates, there are still staffing requirements. But in fact, daytime, no inmates are present. There is no need for us to have health workers or staff members or nurses. So this is not, there is no need to do that. And I have to spend money to employ staff members. We've got only 20 inmates, so we cannot afford 4 to 6 staff members. So we don't really have enough money to operate, and we have to pay rent. And it's also difficult to fill vacancies. As pointed out by some other deputations, there is a great demand for psychiatric nurse and health workers. And we have to give pocket money to these inmates, 500, 200, 700. So we are not really getting the full CSSA payment they receive, and I have to pay 100% rent and 100% staff salaries, and I have to refund some of the payments I received to the inmates for pocket money. So I decided to close my RCHD because it's pointless for me to go on. It's not viable. So small RCHDs and similar RCHDs will face major problems in license application, because previously RCHE's legislation was much lenient to satisfy 5 services requirements. Well, in 2007, there were more exemptions, but for the current legislation, the latest legal requirements have to be fulfilled. So it's very difficult for us to make all the improvements with our resources. Thank you. Madam Hoi Lam from Yikfeng Wulei Zhongxin. Chairman, good morning. I'm very pleased to have the opportunity to speak here. I agree to legislation for RCHD so as to enhance the quality of service and quality of life of service recipients, and this will also enhance the professionalism and status of our industry. Now, for in-service training of nursing staff, I agree entirely. I hope the SWD and also the Department of Health can come to our RCHDs to offer in-service training, so that our staff can have the opportunity to receive training, and this can also spare us the problem of going out to receive training, so that we can have more time left for our inmates. The Children Association talked about our staffing ratio, and they're comparing us with NGOs. In fact, in terms of cost, we can hardly compare with them, because the CSSA payments we get, well, as pointed out by Mr. Zhang, some inmates will have to refund some of that to inmates for their pocket money. So our resources are tight. While we want to enhance our service quality, where can we find the resources to employ better staff and more people? So I hope the SWD can pay attention to this point. And the improvement works. Well, small houses in the NT have unauthorized structures such as canopies. It's not that we don't agree to remove the unauthorized structures, but the landlords would not agree. Perhaps there is no agreement, and we don't have the right to remove UBWs of landlords, and we don't also have the means to restore them after our operation. So it's not that we don't have the will, but we don't have the power to do this. So these are just my preliminary views on the legislation, and I look forward to be enlightened by you, and I hope the administration can help us to smoothly move into this new licensing regime. Thank you. Ms. Michelle Kwok from 樂悠居康復中心. Thank you, Chairman. Some members of the industry said that some RCHDs may have to close due to several reasons. It's not that RCHDs do not want to improve our quality of service, but there are factors beyond our control. For instance, the OC of the building objects to the improvement works because the SWD may post up a notice, and the other flat owners may come out to object to our suggestion. And for my RCHD, on the ground floor, there is a small garage. The license or the permit of the garage is for beautification of motor vehicles. However, it is operating illegally. Because of that, I am not able to operate my own business because of that. So that owner committed a crime, and I've been punished for that. So we cannot use the space just above the garage for my operation, but that has greatly added to my operating cost. And there are neighbors. We are subject to a lot of factors beyond our control, and the problem of staff. Yes, it's very hard to fill vacancies. Even NGOs have difficulties in recruitment, not to mention private RCHDs. We want to seek help from SWD, and we tell them that we have take advertisements in newspapers many times, and they will say that, well, we won't listen to this. We just want to ensure that you have full strength. Well, this is very chilling. What is the relationship between the administration and the industry? The administration must reflect on this. And many certificate of exemption for NGOs is 18 months, but for us just 12 months. NGOs have more resources than we do. How come they get 18 months as a grace period to tidy up their premises, and we only get 12 months? This is so unfair. Some of us would just like to operate an RCHD with low level of care, but they may say that no, you must offer a higher level of care, moderate level of care, and as a result, the manpower planning will be totally different, and we may have to close down because of that. Thank you, Ms. Kwok. Now, if possible, please give us a written submission of or a note of what of your remarks. You can do so after the meeting. We still have some time left. Mr. Liu, you were not done yet, and I think you had an important document, so I give you some time to complete your remarks. Yes, some suggestions from my association. It can be found in our paper. First, fine-tune the lump sum grant mechanism so that there should be a special allocation for employment of nurses. And the second suggestion is we propose to enhance in-service training of RCHD's nurses so that we can retain them, so that they feel that there is career prospect in working in RCHDs. And the reply from the Department of Health is, or from the HAS, for enrolled nurses serving the welfare sector, if they are interested in enrolling in the PLCC organized by the HA, we can consider allowing them to be enrolled in geriatrics and rehabilitation specialties. So the HA has opened the door for us. I hope SWD can make use of PLCC organized by the HA to enhance in-service training for nurses. For instance, there should be extra grant to our CHDs so as to sponsor their nurses to take part in PLCC courses offered by the HA, and to give extra funding to the HA so that they can run out PLCC courses just for nurses working in our CHDs. And our CHDs can nominate nurses to take part in these courses. First of all, and lastly, I hope that the administration can implement these measures as soon as possible so as to retain nurses in our CHDs for better care and attention to inmates. Thank you. We give the floor to the administration to respond before I open the floor for Q&As. Commissioner, thank you. The development of our CHDs and also the latest situation in the licensing situation. Yes, we'd like to report to you the status as at the 1st of May. And regarding operational matters, I will invite SWD to respond. First, I agree with some deputations regarding the overall direction of development. Our intention is to continue to enhance community support so that for PWDs who have chosen to continue to live in the community, they can get all the support they need so as to relieve the pressure for our CHD places. And even if they are waiting for a place in our CHDs, they can get some support from community service. We will enhance home services for people with severe handicap. And we will continue to adopt a three-pronged approach to help PWDs. As pointed out by parent representative, subvented institutions is still the mainstay of our services. There are about 12,000 subvented places, and for private homes about 4,000, and self-financing about 400 places. So subvented homes will still be our focus. We'll continue to identify premises for such establishment, but we do recognize the importance of private RCHDs in providing services because they are very flexible and they can take care of some of the needs. The purpose of the licensing scheme is, first, to ensure that residential care services fulfill a certain standards, and that there will also be the viability of hostels concerned. Why should the living space be 6.5 meters squares per person? That is already the minimum in the relevant requirements, and also for BPS conditions, the requirements are even higher. We want to ensure minimum standards for our for the inmates, and we hope that the FAS can help private homes to develop. For BPS, yes, we are reviewing it. For instance, there have been suggestions that we should increase the ceiling for places purchased in an institution.
So the BPS is a pilot scheme, and it will run for 4 years. And after that, we will have a comprehensive review. We will look at the subsidy level, etc. Now, we hope that in the market there can be more quality places. So we will look at our experience, and we will also look at the views of the users and the RCHDs before we make a final decision. And also some representatives have talked about the latest situation, and I would also like to touch on this point. As for our licensing office, it has been working very hard. Now we have 316 RCHDs. Well, 2 of them are new applicants, and we are now processing the applications. And 5 private RCHDs will be closing. As for the remainder, some of them have already got a license, or they are having a COE. And for the 2 new applications, well, one of the institution is not open yet, and the other one is an RCHE, and it wants to be converted into an RCHD. So there will be no impact on the residents. Now, as for the 7 RCHDs that I mentioned just now, one of them has already stopped service, so there's no inmates there. And for the other one, is now applying for a COE. It has changed its mind, and now it's successfully got a COE. So for the 5 remaining ones, the residents involved are 45. And SWD staff have contacted this institution already. We know what the situation is. 37 of the inmates have already found places in other RCHDs, and they will be moved there. And for the remaining 8, some of their family members have already found new places or homes for them, and there are also social workers helping the other family members. So our staff will continue to follow up on these cases, and we are keeping a close contact with their family members. Now, Mr. Fernando Cheung mentioned about this last time, so we will be follow up on these cases, and we will provide assistance in an appropriate manner. Some deputations also mentioned the need for nurses. Yes, we understand that. In 2006, we started a 2-year registered nurse training courses with the hospital authority. We have held 12 courses like this, and the 1,500 nurses have been trained, and they have to work in the social welfare sector for 2 years afterwards. So for 2013 to 2018, we will provide 10 more courses, and 1,240 places, training places will be provided. So it's not just about nurses, and also there will be physiotherapists, occupational therapists, etc. So for degree courses, the number of places will also increase. And also the Secretary for Health and Wealth will be heading a review panel, and it will be reviewing the healthcare manpower demand. We hope that there will be more supply so that the problem of manpower in the healthcare sector can be alleviated. We know that from 2009 to 2010, we have been providing subsidies to subvented RCHDs so that they can have more resources and employ more healthcare staff. Now, in the coming 3 years, we will continue to do this. So in terms of healthcare manpower, we hope that we can provide more support. Now, some deputations asked us if more trainings will be provided. Actually, we've been talking to the Education Bureau, and now we have new qualification framework, and there are also areas covering healthcare staff for RCHDs. So I'm sure the qualification framework will also be helpful. some deputations also talked about short-term stay service for children with disabilities, and we will follow up on this point. We agree that this kind of service should continue. So when it comes to actual operations, maybe my colleague from the Social Welfare Department can give you an answer. Just now, some deputations mentioned that they want to apply for a license for low-level care. And it seems that we rejected such applications. Now, for our license and COEs, actually, some institutions have applied for the low-level care license, and some of them are private RCHDs. So for the code of practice for RCHDs and the regulations for RCHDs, there are different categories. Now, there are institutions where high, medium, or low-level care will be provided. So there are different categories of RCHDs. For low-level care institution, it means that the care homes will be providing a residential service for PWDs, and these PWDs can basically take care of themselves. For example, they can take their own medicine, they don't have to be reminded, and also they can wash their clothes and cook their own meals. So there are some indicators as to what is meant by capable of self-care, and also they only need a low level of care from other people in their daily lives. So the SWD would look at the relevant requirements when it comes to the application for a license or a COE. So no matter whether it's a self-financing or subvented or private RCHDs, the treatments are the same. And also, when an RCHD operator files an application, we will look at the health certificates of the inmates, and also our inspectors will go to the actual institution to check on the inmates, what their actual conditions are like and what kind of care they need, etc. Because for the whole licensing scheme, our aim is to ensure that the RCHD residents are taken care of properly, and the service quality must be acceptable. So for our inspectors, when they visit the RCHDs, they would look at the service levels and what kind of services are needed by the inmates, and also we would try to consult doctors when it comes to professional views concerning such RCHDs. So we have to ensure that these RCHDs are providing the care that inmates need. So when operators come to apply for a license or COE for operating a low care level institution, and when we visit the institution and find that the inmates really only need a low level of care, then we would not reject this kind of application. And for the licenses and COEs that we have already issued, well, some institutions have successfully got this kind of license, that is for low care level, and these are private RCHDs. So this is the point about low care level institutions. And also some deputations mentioned the planning permit or planning permission. Well, for RCHD operators, they have to ensure that the premises used for operating RCHTs must comply with the relevant laws, including the layout plans, the use of the land use of the premises, etc. Now, this is in Chapter 5 of the Code of Practice for RCHDs. Now, this is clearly stated in the Code of Practice. And if an RCHD does not comply with these rules, now it has to make applications to the Lands Department or the Town Planning Board, and exemptions have to be obtained from these authorities. Only by doing so can these operators continue to operate their institutions at their present locations. Otherwise, there may be law enforcement actions taken and the inmates will be affected. So for private RCHD operators, when it comes to the land lease or planning, if they encounter problems, then actually SWD is very willing to help. We can provide advice and we will assist the RCHDs in filing their applications. Actually, in the past, we have seen successful examples. I can cite some examples here so that members and deputations can have a better understanding. Now, for the SWD and the Lands Department, as well as the Planning Department, we have been coordinating. One RCHD received a COE last year from the Planning Department so that it could operate in situ. And also another institution has got a planning permission from the Town Planning Board. So these two RCHDs have successfully obtained licenses from us. So if an RCHD encounters planning problems, it can talk to our licensing office. Our staff would be very pleased to help. Some deputations mentioned that, well, for this kind of application, it may involve consulting the residents in the vicinity, and some residents may be opposing their operation. So we will adopt a pragmatic manner and we will contact the residents accordingly, and we will also be liaising with the relevant government departments, for example, Home Affairs departments as well as district councils. We will try our best to cooperate so that a solution can be found. In the past years, at the community level, we have been very active in terms of community education. We hope that the residents can have a better understanding of the needs of PWDs, and PWDs need to be integrated into communities, and we hope that they can accept that such facilities can be built in their backyard. So this is about the planning permission. And for the third point, Chairman, if you allow me, then I would like to talk about health workers. Now, for health workers, because now we have a licensing scheme, we have been providing training courses for health workers. And 17 educational institutions are providing 58 training courses for health workers. And up to now, in accordance with the RCHD Ordinance, 700 health workers have already registered. That is, they have already completed the relevant training courses. Some deputations also mentioned that they encounter problems like this. That is, they want to recruit a health worker, but he or she has not been qualified yet. So when you make an application to us, you can tell us about the timetable of training these people. Now, when we issue a license, we have to ensure that the inmates of an RCHD be properly taken care of.
If a home has got a certain number of staff members who require such training, we're willing to, the SW is willing to discuss with the training providers so as to organize appropriate courses at appropriate locations for in-service training of health workers. And some deputations mentioned our pilot BPS. It started in 2011-12. We hope that in phases we're able to purchase 300 places. So far, we've got 6 institutions under the BPS offering 245 places. The take-up rate has been as much as 95% so far. Well, later this year, we're going to embark on the second stage, BPS. It also depends on the number of quality places available in private homes for our scheme. We've recently conducted a midterm review of the BPS. We will give regard to the views of service providers and service users in making improvements to our scheme. Some deputations expressed a worry that we will rely on subvented or BPS homes to satisfy the service demand. In fact, we'll continue to increase the number of subvented places in the coming 5 years. 2,700 more places will come into service. Thank you very much. All right, questions from members now. Perhaps I set a time limit of 5 minutes for each member, and we can go on so long as we have time. Mr. Tan Ka-piu, Lower Court, and then Dr. Fernando Zhao. Mr. Tan Ka-piu, first of all, I want to thank the deputations. We have got operators and monetary bodies and also professional organizations present. And we've just heard the response from the administration. I think we have been very frank in letting the other party know what are the difficulties. Of course, we don't want inmates to be displaced or affected because of the legislation. But of course, we don't want them to continue to live in substandard homes. Now we have got 45 cases and 37 have been successfully placed, and there are about 8 left. Now, I'm a little bit assured, and I hope that the remaining 8 displaced inmates can find new places very soon. All right, a certificate of exemption. Of course, I was not party to the last LegCo, but I think many organizations are worried that the legislation does not forbid COE to be extended indefinitely. So even during the deliberations of the bill, that was a point raised. Now, of course, we've moved into a new stage, and the ordinance would take full effect quite soon. Most private homes can only get an exemption of 12 months. I'd like to know whether there will be no extension after that, or, for instance, if works are only half done, can the exemption period be further extended? So can you tell us the criteria for renewing or extending the exemption? Under what circumstances can the exemption be extended or terminated I think that is good for both the public and operators, so that the former knows how they can monitor, and the latter will have a clear idea of what will happen. And it's also not a question of whether operators are willing to invest resources, but there are factors beyond their control. I know even for subvented homes, it's not easy for them to get the support of the community when there is consultation. And for private homes, if you have a public consultation to allow the public to object, yes, it's good to have a transparent system, but they indeed face a risk of objection. So can you tell us the number of cases where COE was granted because of objection from the community? So it's not about they're not fulfilling the fire safety or structural requirements, but rather objection from the community. As legislators, we cannot blame the operators for these factors. And also the subsidy, 50 to 60% subsidy. I'd like to know how many homes have applied for that, and how many cases have been approved. And a broader question, and that is supply of places. The monitoring bodies, of course, want the living space to go up from 6.5 to 8 square meters, whereas for private homes, the allocation used to be 4, and now it is raised to 6.5 square meters, and they find it hard to cope. I'd like to know the number of places being offered, and then after the COE period, the number of places available. All right, please let us know. Just a very limited time for the Commissioner to respond. Thank you. COE is certainly a transitional arrangement only, with the ultimate aim of granting a license. The purpose is to allow RCHDs to have sufficient time or reasonable time to carry out improvement works. When a license or COE is approved, we will consider 4 important aspects. First, the management of the RCHD, that would cover the staffing and size. And second, the level of health care, the quality of care. And 3, safety, building safety. And 4, fire safety. When we issue a COE, we have to ensure that a home has achieved the standards in terms of management and quality of care. Well, an RCHD may have to provide barrier-free access, and also fire safety installations. But meanwhile, it is still in operation. So we have to ensure that the quality of care is guaranteed for the inmates. So the additional conditions in our licenses will always be usually be a building safety and fire safety. The member asked whether a COE cannot be granted because of a problem with planning approval. Usually, the licensing conditions will be to require the RCHD to apply for planning approval. This condition will be included in COE. Colleagues, or rather members, refer to places available. private homes are providing about 4,000 places. Self-financing homes, about 400 places. Subvented places, about 11,800. So these are places being offered by homes covered by a license or COE. Thank you. Mr. Kwok-che. This is about the commencement of the residential care homes persons with disabilities ordinance. So I think it should not be the scope of our discussion when it comes to service standards. So this subcommittee is concerned about the possible implications of the commencement notice to the industry. Now, private homes, well, of course, subvented homes provide 11,800 odd places. Private homes provide about 4,000 places. So this is also an important service provider. When the commencement date is due, then there will be impact on these private homes. And then the association has provided us information on the operating cost of private homes in village houses and in residential premises. I visited a private home operating in a small house, a village house, and I think the figures they quote are very realistic, and the costs are about to go up further and further. We understand the inflation and also prices in food. Even canned foods are so much more expensive nowadays. So I hope we will not be too high sounding. We must be down to earth. Now, the living space per person will be raised to 6.5 square meters, and enhanced quality of service must, in return, get better return. So if most of these inmates rely on CSS payments for paying the fees, well, this will affect the viability of private homes. So you may say that ample time has been granted to RCHDs for them to comply with the regulations, but we should allow the industry to tell us something more about the difficulties. According to the Commissioner, everything is fine. They've already given a grace period, but we should give time for private homes to tell us their actual situation. Because according to industry, there will be another 1/3 of the private homes in operation to close. All right, 2 minutes. Anyone? Mr. Lee? You have all received a report from me. I have listed out the operating cost of a private home. And you can see that we are only talking about very basic requirements in terms of manpower and also rental.
Now the biggest problem lies with operation. Actually, we cannot balance our books. And now we are asked to put resources into improving the living environment. This is really difficult. And it's difficult for us to see a future. Maybe some members have not taken part in the early stages of this piece of enacting this piece of legislation. Now, the SWD has been saying that we are making money. Actually, this is misleading because we have depreciation cost. Now, when you make an investment, you have to take depreciation into account. Now, if you just look at the old documents, you will see the expenses of manpower on rental. But how about depreciation? That's a huge cost as well. Now, if we are spending $500,000 on an RCHD, and we think the year of return is 3 years, and actually for each month the depreciation value will be $350. For my RCHD now is providing 430 places, and it accounts for 10% of the market already. I estimated roughly last month. Now for the rent, now it's $17.17. That means each inmate is paying $1,717 for rent. So for each inmate, if he has to pay for rent, and for the health workers, he has to pay $1,818, and they're relying on CSSA, and for CSSA it's about $5,000, and we are not getting the $5,000 completely, because some money will have to be spared for the inmates' pocket money, and also that would have to be spent on his meals and on other expenses. So actually we are just getting $4,000 and we are already spending $3,500 on rent and manpower. So the remaining amount will be used on meals. Originally, we were providing 4 square meters for each inmate. Now it's increased to 6.5. So the cost has increased significantly. Well, in the past, we were trying our best to economize, but now the law requires us to do much more. But we have the same income. Now you have read the newspapers, you would know that for restaurants, because food price has gone up, they can increase the dishes by $2 each. But we cannot do that. Now for legislation, yes, we want new laws to protect the people. We want the industry to develop, and we want to provide better service to PWDs, etc. But if you look at the figures, ever since the enactment of this piece of legislation in November 2011, the industry has been shrinking. Some institutions even have to fold. And there has been no new RCHD. So you can see that there has been a significant recession in our industry. So what's the point of legislation? And actually, you are just reducing number of RCHDs, and poorer service will be provided to the inmates. Mr. Fernando Zhang, thank you. Now we are talking about the commencement date. So for the direction of legislation, we want to improve the quality of RCHD. So we want the commencement date to be as early as possible. But as the discussions pointed out just now, there are actually a lot of contradictions and complexities. Now, when we look at it from the angle of improving quality, yes, we want the legal requirements to be as high as possible, and we want the piece of legislation to commence as early as possible. However, in reality, private RCHDs have been operating with a low cost in the past, so they have been sacrificing their service quality and space per person. But now they have to meet the new requirements, so they face a lot of difficulties. Now, from the perspective of a user, I would like to say that I'm also a family member of a PWD. Of course, we want the legal requirements to be as high as possible. Now, in 2012, 2002, the SWD formulated its own code of practice for RCHD, and actually now the requirements are much lower. Well, 11 years ago, the space required was 8 square meters, and now with this legislation, we have already compromised. So some user organizations are saying that these should not be lowered. However, for private RCHDs, 6.5 square meters are already too big for them. So here is a contradiction. And we see these kind of contradictions among different stakeholders. Of course, as users, we want the RCHDs to be as big as possible. But for businessmen, of course, they have to look at their costs and profits. Otherwise, they would not do the business. The government should shoulder the responsibility. Actually, such RCHDs should be subvented by the government. This should be the core of this whole service. The government may say that, yes, the subvented RCHDs are the core, but we still see a huge shortage. And you're working at a very slow pace. That's why there is a market for private RCHDs, and we still see a huge demand in the market. And you will have to wait for 10 years to get a place in a subvented RCHD. So that's why there is a private market. Now, in the past, they were not regulated by the law, so they operated at a very low cost. And some of them are of very poor quality. Well, when I was a member representing the social welfare sector, I tried my best to force the government to legislate in order to regulate these institutions. So what is the government's direction now? Now, if you're saying that subvented RCHDs are the core, then I think you are working at too slow a pace. Now 7,000 or 8,000 people are waiting in the queue. In the coming 5 years, you only will provide 2,500 places, and that's just about a third of the demand. And that's after 5 years. So how can you provide service to all these people in the line? So for the long-term policy, I'm not going to talk about it today. However, I would like to seek clarification from you. Now, because the private RCHD's view is very different from the government's view. Now, the RCHDs or the private RCHDs insist that about 1/3 of the private RCHDs will have to close. And the commissioner told us that's not the case. Only 5 private RCHDs will close. So if there are 78 private RCHDs and we are talking about 1/3 of them, then it involves 1,000 places. And actually about 20 private RCHDs will have to fold. So what exactly is happening here? Why is there such a big discrepancy? Government? Commissioner, can you tell us, or Assistant Director? Well, let me tell you again the figures. Actually, we got the figures from the SWD. Do you have a projection? You're using the figures you got on the 1st of May? Well, for private RCHDs, well, some of them have already got COEs. Well, some of them have not made an application up to now. And on the 10th of June, Part 2 will come into operation and some institutions will close. Now, can the Commissioner tell me more clearly? Among the 316 institutions, 217 of them are subvented, 21 are self-financing, and 78 are private. So how many of them have already got a license? How many of them have got a COE? Among these 3 categories, can you give us the figures? Yes. As of today. Yes, we have the figures. As for license, For subvented RCHDs, 5 of them have got licenses. Self-financing, 3. Private, 8. As for the remainder, subvented 213 of them have got COEs, 16 self-financing RCHDs got COEs, and 63 private RCHDs got COEs. But I would like to add that for our licensing scheme, we have a goal. That is including subvented RCHDs. Well, they complied with the fire safety rules at that time, but now we are issuing a new license. So we will have to look at the latest building and fire safety standards. So that's why most of them have to carry out improvement works in order to meet the licensing requirements. So that's why most of them have to apply for a COE for now. So only a small number of RCHDs can get the license. Now, 18 months after this piece of legislation came into operation, only 7% of them have got a license, right? That's a very small figure. Chairman, can we ask the private RCHDs, among the 63 who got COEs, now how many of them can not get a license within the validity period or within the grace period? Well, it was mentioned that 1/3 of them will close. So can Mr. Leung give us an answer? Yes, that's what I said. Mr. Chang, you're very concerned about this. I would like to thank Mr. Chang for asking the question. Now, for operating private RCHDs, I have only been doing it for the past 3 or 4 years. Actually, the operators know very well what's happening. I'm not saying that the government figures are wrong. Those figures are real because they got the figures from us, but they are not operators. They do not understand the difficulties the operators face. Now I would like to tell you what problems we are facing. First, our premises. Now, the property price has gone down a bit, but the rental level has not dropped. Now, if I have a huge space, then I would not operate an RCHD because I won't make much money from it. I'd rather use the space to run a boutique or a restaurant. For those who are operating RCHDs, I think they really have the heart to do something. Now, I'm not Li Ka-shing. I do not have a lot of resources. So the premises are very important. As the chairman said just now, well, as the other gentleman said just now, his RCHD is providing about 10% of the private places, but the lease would only last for about 2 years. Now, when you renew a lease and for example, if I tell my landowner, I say that I want the lease to be longer because I want to put in more investments, then the landlord will say that, how can I discuss with you? Now, what if I increase the rents by 100%? So I really was speechless. So if you're running a home for 400 inmates and if you encounter this kind of problem, how can you keep on operating? Now, I think more than 1/3 of the private RCHDs would face this kind of problem. So, in what space are these RCHDs operating? One of our expenditure is renting a place. That accounts for a huge part of our expenditure. So it's very difficult for us to balance our books. Mr. Lee?
I'd like to address the point about possible closing of RCHDs because many of them cannot meet the requirements on fire safety and building safety. And there are technical difficulties in improvement works. Sometimes it's not a question of money. We have to compete with our CHEs. We are competing for premises. Housing is a problem in Hong Kong. It's very difficult for us to identify a suitable place for our operation. In the past, there was no legislation, and we could go for places where our CHEs could not operate. Well, even NGOs have so many things to improve, not to mention us. I'm operating seven homes, or rather one has closed. There are only 6 left. Let me use one as an example. At first, we were not required to have sprinkler systems so long as the floor space was not over 230 square meters. But now it has changed. Instead of looking at the floor space, you have to consider the whole building. So when I first opened the home, I did not consider that. And I followed the code of practice. Now it was a single block building. How can I have a sprinkler system for the whole RCHD? This is not a question of money. I don't know where to place the water tank for the sprinkler system, so I can have only 2 options. Either I cut down the floor space from 4,000 square feet to lower than 230 square meters. So I have already rented 4,000 square feet. And the second option is to close because I cannot satisfy the technical requirements. I cannot rent a whole floor, a whole block, just to use 2,300 square feet for the operation. So I have a suggestion. Since there is an FAS to improve existing RCHDs, I've said this to the SWD a number of times, can we use the money in a more cost-effective manner rather than spending hundreds of thousands of dollars on just 2 inches? Can the money be spent on helping us to relocate? For instance, for my RCHD, $1 million will have to be spent for the sprinkler system and the water tank. Perhaps it is a win-win situation if that $1 million is spent on moving my operation to another new location. Thank you very much. I thank the deputations for coming this morning to exchange views with us, and we've heard about the operational difficulties of private homes. The Commissioner told us that the commencement date will be the 10th of June 2003. We're concerned about the arrangements for displaced inmates. All right, there are 45, and they are in general, they have in general found alternative accommodation. The Commissioner referred to new homes. I'd like to know whether they are subvented homes or private homes and the licensing situation. And the Nursing Association has given us some suggestions. They know that the wastage rate of nurses and their morale is low. Wastage rate is high, morale is low for nurses working in private homes. And they have proposed to change the lump sum grant mechanism a little bit so that there can be a special allocation for retaining nurses and to enhance their service quality. Will the administration consider this? Assistant Commissioner? I think you're referring to 2 new private homes waiting to be licensed. However, they applied after the 18th of November, which was the enactment date of the legislation, and therefore they are not eligible for COE, which is only available for existing RCHDs before the enactment of the ordinance on the 18th of November 2011. The member asked when the 2 homes can be licensed. Well, they need improvement works, so we have to wait until the improvement works are done to ensure that they comply with our licensing requirements before they can be licensed. So I won't be able to tell you the actual time frame, but the important thing is for them to complete the improvement works first, because they are different from pre-existing RCHDs. For those, we can give them a COE with a reasonable period for improvement works. But because that is a new home, we will not grant COE. And as for allocation, in 2012-13, we have allocated $340 million from the lottery fund for non-subvented homes to recruit and retain allied healthcare professionals, including nurses. So that covered a 3-year period from 2012-13 to 2014-15. In other words, through the lottery fund, you have made available money for recruitment and retention of nurses, and you are not going to fine-tune the lump sum grant mechanism. Under the lump sum grant mechanism, RCHDs are flexible in using the resources they get. And under the lottery fund, we have already made money for that, and we do not just have the lotteries fund. As mentioned by the Commissioner, universities are offering more degree places for nurses and allied health professionals. From now or in the coming 5 years, we will offer another 10 classes, especially for EN serving the social welfare sector. That will mean another 2,000 odd places. But you've already mentioned that, Assistant Director. The important thing is you say that there is flexibility for use of fund granted under the lump sum grant mechanism, but I don't think that's the perspective of the operators. All right, $300 million from the lotteries fund. We've consulted many nurses serving RCHDs. They're not aware of the details of the allocation. Even nurses who are managers of RCHDs, might have heard about the fund, but they don't know about the details. They don't know how to apply for it. So can the department or the administration consider promoting or publicizing the availability of the money to the industry? We have made it very clear to the non-subvented organizations the purpose of the fund. It is for recruitment of allied health professionals and retaining experienced allied health professionals in social welfare operations. So they should know, but of course they would like us to remind them of the use of the allocation. We are willing to do that. Mr. Tankabiu. Thank you. Second round, Chairman. 5 minutes. Okay. I think one of my questions has not been answered yet. and that is 60% of the FAS. How many of them have been approved? I know that there is a prerequisite for application under the FAS. There must be a 2-year tenancy in force. And I understand that there have been a lot of bargaining about rental with a landlord. Do you know that it is difficult to obtain a 2-year tenancy? And secondly, 8 has been licensed, 63 has got COE, 71 of them. How many of them are operating in self-owned premises? I understand that rent is a big problem. It's difficult to deal with landlords. So the risk of operation in leased premises is high. So can you tell us how many of the homes are operating in their own premises? And Dr. Fernando Cheung talked about the positioning of private homes. Private homes face a lot of operation difficulties, and the rent fluctuates a lot. So this will affect the supply of places. Can you tell us the percentage of places to be provided by private homes and the percentage of places to be provided by subvented homes? Mr. Tang asked about our policy. Well, we have a 3-pronged approach with subvented places being the mainstay, and we know that there is a shortfall in the supply of private places. The licensing scheme has just started. Yes, we mainly rely on subvented places, but we hope that private homes can grow in a healthy manner, providing quality care. So we will review our enhanced BPS in terms of the ceiling of places to be bought in a home, and as regards the number of quality places in the market, well, this is a developing process. We will discuss with the industry as to how improvements can be made. Our direction is we hope that private places will be of quality. As Dr. Jiang said, there is a great demand for good private home places. We hope that the private sector can develop in a quality and healthy manner. Mr. Lam, we've received 2 applications under FAS, and we know that some private homes are planning to apply under the FAS because they need to get a COE first, which will have conditions requiring them to make improvements in specific areas, and these homes can then submit applications with details and to invite quotations. I've had a meeting with private homes recently. I know there have been queries as to what are the approved items, and in June we will have another briefing for RCHDs, private homes, to brief them on the details of the FAS and to let them know what are the approved items to allay their concerns. And how many of them are operating in self-owned premises? How many of them in leased premises? We don't have any actual figures, but I think only a very small number of them will be in self-owned properties.
Assistant Director, how about the 2-year tenancy? Yes, one of the requirements is a 2-year tenancy. Now, the thinking behind that is the co-sharing of cost. Now, the government will be forking out 60% so that the RCHD can operate for a reasonable period. But we are also monitoring the rental market very closely, and we have talked to the private RCHDs. Now, sometimes the landlord may not be willing to enter into a 2-year agreement with them. But if we can get a letter from the landlord stating that is willing to rent the premises for a certain period of time, etc., then we will also consider the application. Now, because this is co-sharing of the cost, so the private RCHD would have to carry out improvement works, and I'm sure they would be willing to continue to operate. Now, if an RCHD has only a 1-year lease, it also wants to make improvements because it doesn't want to see that its COE cannot be renewed. Now, if the landlord can issue a letter of intention, the landlord may have reservations because he may be afraid that he would have to bear the legal responsibility. And the RCHD also want to make improvements because he has to fork out 40% as well. So what would happen? Well, we need to see a sort of intention, because we need to know that the RCHD can continue to operate for a reasonable period of time. In particular, under the financial assistance scheme, public money is involved. So we need to do it in a reasonable manner. I would like to interrupt here. Now, just now, Mr. Tan Ka-pil mentioned that the landlord may have to bear legal responsibility or liability. So there must be a letter of intention from the landlord. So is there another thing that you can accept instead of the letter of intention? Can such a template be provided to the operators and the landlords? Because the landlord would be reluctant to write this kind of letter. Yes, we will talk to the private RCHDs concerning this problem. In June, at our briefing session, I hope that we can give some advice to the RCHDs. Well, for planning permission, if I cannot get it, then I would not carry out improvement works because that will cost hundreds of thousands of dollars. And if I do not get a planning permission from the planning department, then there will be a huge problem. Can the government help us? It's not that I'm not going to apply for a planning permission, but if I do that, I'll have to find a consultant, have to spend money on that. Well, some consultants have told me that they would charge $80,000 for that. You are thinking that the consultant would help you, but that's very costly. Well, the SWD is saying that it will help private RCHDs. Now, can we do this? Okay, a private RCHD will submit an application, and when it comes to planning, can the WD send a planning application to the planning department? We will provide the supporting documents. Would that be a better way of doing it, and will the success rate be higher, and will the whole process be faster? Because we really dare not apply for the FAS. In our code of practice, it is stated that the RCHD operators must ensure that their premises comply with all the rules. Now, just now I cited some successful examples. They've got planning permission, and the RCHD operators made their own applications, and they were successful. For the COE, there are additional conditions. That is, there must be a planning permission. Now, if the LCHD operator, in the course of making the application, if he has done that, and if he can prove that he has already done that, and then after 12 months, he needs to renew the COE, then we would try to check whether in the past 12 months he has taken the relevant actions. Now, if we are satisfied that he has taken the relevant actions, it's only that the planning permission has not been granted yet, then when we consider the renewal of COE, we'll definitely take this point into consideration. And for that application, it has to be filed by the operator. And past examples show us that this can be successful as well. Can the government help the LCHDs a bit? Now, before they file the application, can they get advice from you so that they can overcome certain obstacles? Because you can give them professional advice and then they can do the work. Can you help them in this regard? Well, Chairman, we are willing to provide advice and assistance. And if there is a need to communicate with other government departments, we are also willing to help. But of course, the application has to be submitted by the operator himself. Well, what I'm suggesting is that the department can help us so that the application period for planning permission can be shortened. Because in the course of doing all these, if I am to make an application, it will take a long time. And I have heard some cases, and actually there have been some referrals to us, and people will query that we are still holding a COE, and they are wondering if we can operate for long. Well, it's very clear. The assistant director said that the LCHD would have to take the initiative. It will have to file its own application, and SWD can give you some assistance. Just now, Mr. Lee asked if this application period can be shortened. Mr. Chang, do you want to say something? We have been talking a lot about this. And for private LCHDs, they have to do a lot of work in terms of manpower, in terms of space, etc. However, there's a ceiling to our income. We just have $5,000, and you can see the cost per capita is over $3,000, and we can only make a profit of $1,000 or so. Yes, we understand that. So I think we must have more resources. And there are not enough training courses for our workers. We cannot recruit the appropriate people. Ms. Ng? I've been talking to different fire safety facility companies. They have given us quotations. As for payment, it's 3331. Well, for 10% is for the warranty period. Now I have to fork out 30% first, and for the remaining 30%, when the materials arrive, I have to pay up. Can I talk to the SWD? Can they give me a letter? That is, subsidies will come from the lottery fund, and the fire safety facilities companies would accept this, because I really cannot afford to pay 3331. I have talked to Hong Kong Bank, and I apply for the small and medium enterprises loan, and the manager scolded me. He said that I should not be there. So I really don't know where I can get money for 3331. So there are three questions. Two are about licensing. First is about shortening the application period. Second is how you can guarantee so that the RCHDs would have a better cash flow. Now, for shortening the application period, because when it comes to granting the planning permission, it's not done by the SWD. In the course of doing so, we can provide you more assistance. We'll try our best to communicate with the relevant department. And we will try to make the RCHDs understand more what they need to do. We hope that by doing so, the period can be shortened. But I really cannot promise you here that this can be done. So can I give you an opinion? Please talk to the Town Planning Board. Well, after they fix a date for their meeting, they should inform the private RCHDs. And they have to tell the RCHDs that before this date of meeting, you have to file your application. Otherwise, you will have to wait for another round. Because for the private RCHDs, when they send a letter to the Town Planning Board, maybe the Town Planning Board just had a meeting and they have to wait for another 2 to 3 months. I think the SWD can definitely do this. So if you give the private RCHDs a date, I'm sure they know how to work accordingly. Second, about cash flow. So when an application under the FAS is successful, we will send the applicants a letter telling them that they have been successful in getting this financial assistance so that they can carry out their improvement works. So there will be a letter sent by the SWD. Ms. Kwok, so are you talking about this point? Yes. Fernando Zhang. Now, this piece of legislation has come into operation for 18 months, and Part 2 will have to come into operation in June as well. And we can see that the private RCHDs are finding it very difficult to do business now, and because many of the inmates would have to rely on CSSA. Now you are wrestling with the government. Now you need financial assistance for carrying out improvement works to your hardware, and also you need more manpower, and you want the government to give you more help. But of course the government will think that you are in the private market and you are making profit. So if the government helps you, it seems that it's very difficult for the government to explain itself. You are saying that 1/3 of the private RCHDs would have to fold. The government said that's not the case. So the government thinks you are bluffing, and the private RCHDs thinks that they really cannot keep on anymore. So I think you all have your justifications and you are both telling the truth. However, the people who are suffering are actually the RCHD residents. Now, under such a pressure, has the service quality improved or is worsened? Some smaller RCHDs are facing a lot of difficulties, and some of them have already closed. So for smaller RCHDs, I mean those with less than 40 places. And if the occupancy rate is not high, then they really face a lot of operating difficulties. And if they want to continue to operate, I suspect that the service quality might be compromised. Under such a pressure, well, actually, I think in the past, the private RCHDs have been the last safety net. And actually, there were PWDs that were turned away by other RCHDs, and most RCHDs would only like to take care of PWDs with less serious problems. So the PWDs with the most serious problems would have to resort to private RCHDs.
And still they required a certain level of care, so private homes will not accept them. For those who are living in private homes and severe cases, while private homes have seen pressure in operating costs in terms of manpower and space, they will they will cut corners in other areas, and the inmates don't know how to voice out the deterioration, the concern about deterioration in service. Their family members may not know, so I'm worried that the quality of care for these inmates will drop. So, let's be frank, what problems will we face? Over the coming 18 months, well, according to the statistics, most of them are covered by a COE. If quality of service would really be worsened because of the new requirements, please let us know. We will fight with the administration on your behalf. Our purpose is not to help you to make money, but we are concerned about quality of care. All right, Mr. Lee Wing-Yu, I think Dr. Zhang has made a very good point. I said this to LegCo previously. If CSSA payments are not increased, then private homes, of course, have to live within our means in order to be viable. Many private homes are operated by ex-social workers and healthcare workers. We do have a heart, and we don't intend to just provide a place of accommodation for these inmates. We want to provide training. We'll really train mentally retarded kids self-care skills, and we take them out for outings. In the past, when we did not make enough, we lowered the standard of the hardware so that we could spare money to give them training. Now, if we are forced to spend on better hardware, we have no choice but to lower the quality of software. For instance, meals. We used to serve Thailand rice, Thai rice. Now we have no choice. We have to go for rice produced in China, and now even rice from Vietnam. Well, this is a fact. I don't mind telling you. We still serve them 2 bowls of rice, but the origin of rice is no longer the same. In the past, we took them out to the McDonald's or to Chinese tea every 2 weeks, but now, because this is not a requirement of the SWD, we lower the frequency and we only give them 1 birthday party a month. This is a fact. But of course, on the other front, they are better off. In the past, they had only 4 square meters, but now 6.5 square meters, and they can have room for a somersault. All right, if you ask them to choose, I think they'd rather have a treat at the McDonald's. But if you say that, no, you want them more living space, but this is not what they prefer. So it is for you to judge what they prefer. Mr. Liu? I think Mr. Lee has already told us the situation. By and large, they are better off because most private homes are already given a COE, and under the supervision of the SWD, exemption is not granted arbitrarily. There are 4 aspects, and private homes must comply with these 4 aspects before they can be given COE. So in terms of safety and space, of course, they are better off. But it depends on how long we can go on. Our relations with the SWT is very mixed. On the one hand, they are here to supervise us, and on the other, to assist us. So, in my remarks, I said, please do not peg our fees with CSSA payments. CSSA payments are not meant for people to live to pay the fees of a place in RCHD. Now, the cost of a subvented home is $10,000. And in a private home, if you think that $5,000 is sufficient and we can offer excellent service on all fronts, this is ridiculous. I'm not asking for $10,000, but at least you must have a mechanism. For instance, $7,000, $8,000, we believe that will be able to enhance the software aspect of private homes. Well, there are 4,000 odd private places, and I think private homes do have a value, and it's not your intention to drive them out of business altogether. Dr. Zhang said that since the pace of increase in subvented places is so slow, and it's meaningless for you to close down all private homes. Hardware, whether we like it or not, we have to comply with the law, and it's correct that we have to follow the regulations. We will do our best. But for software, I think we are only doing our level best. All right. I'd like to ask a question too. First, I must thank not just the subvented homes, but self-financing homes. Private homes play a very important role in supplying places for PWDs. If 1/3 of them closes, then we will have 1,000 odd places left, and a lot inmates will be displaced. We understand that this is just an estimate, which I think is reasonable. I agree with Mr. Kwok. The figures submitted by private homes are very reasonable. However, SWT doesn't look at it from this perspective. It uses its internal calculation to do the estimates. And I'd like to mention that the previous Assistant Director of Social Welfare said that it was very difficult to deal with an allowance for nursing care in private homes. All right, the fees are either paid by family members, so it may be 6,000 or 7,000. So long as the family members feel that it's worth it, they're willing to buy. And for BPS place, I think they're spending about 7,000 per place, per bed. And the third category of inmates are those on CSSA. I am referring to this group of people. CSSA payments would cover food and accommodation and daily necessities. Okay? Are there a fourth element? No. But if a PWD requires special care, then a special grant is granted for him to employ domestic help. We're aware of that. So if he stays at home, his carer will be his family. And if he lives in a private home, then the carer is the private home. Is there any subsidy for care in a private home? No. I just want to highlight this point. SWD likes to say that CSS payment is just it. That's it. We cannot increase the rate. And the director said last time, or secretary said last time, that it is already a great compassionate move to give $250. But that is not a fee for care. Now, if a PWD lives in RCHD, now you have to spend about $4,000 on Filipino domestic helper. I think she can at most take care of 8 persons, and that would be about $500 per person. And if she has to take care of 4 persons, that is $1,000 per person. So can you incorporate that into CSSA payments? I think private homes have said so much because they would like to have more resources. I think some families foot the bill for that, and I think the government has to pay for some of the inmates. So please, if there is any room for you to maneuver, please consider this. I'm not asking you to raise CSSA rates applicable to everyone, but for PWDs living in RCHDs, can you give an allowance for nursing care? If the person is severely handicapped, can you have a higher rate of nursing care, giving a higher level of care? I think most private homes are not taking care of PWDs that require a high level of care. Most of them require a moderate or low level of care. The administration may not be able to give an undertaking today, or can you do that? At least please express your views. Otherwise, you must go for this. This is inevitable. Well, I think private homes are in business, although they serve with the heart, but they cannot pay out of their pockets in order to run a private home. So you have to make a breakthrough here. Otherwise, the 4,000 places will dwindle gradually. And even though you have 2,700 cases in the coming 5 years, now if all 4,000 odd places are gone, you won't be able to fill the gap with 2,700 odd places in the coming 5 years. So please quickly consider giving an allowance for nursing care. And also BPS. Well, some private homes are operating very well, and you only purchase half or 55% of their places. But for the remaining 45%, well, the operating cost will be higher because your requirements under the BPS is higher than the legal requirements. You say that, well, I give them $7,000 per month, but that is only applicable to only half of their places. Can you move that up to 70%? I'm not asking for 100%. You increase the ceiling to 70% so that it will be more affordable. Because for this level of service, private homes will have to charge $6,000-7,000 per person per month. First, we agree with you very much, Chairman. The best approach is BPS, because it will not just help the market to develop, it will also offer quality places for PWDs. We're increasing the ceiling of places purchased in private home, and also the allowance for for a place in BPS, we are willing to review that. And a very real question is how we're going to help the current private homes. Chairman, you may recall that in the whole legislative process, I think both you and I were fully involved. Many of the suggestions came from the industry. For instance, FAS. There was a suggestion to subsidize 50 to 60% of their cost in improvement works, and now is 60%. And as for CSSA payments, yes, the purpose is not to subsidize private homes. However, in the process, we have been trying our best to improve the system so as to offer more assistance to PWDs. You may recall that other than the regular adjustment of the payments with regard to inflation, we have added separate elements.
For those under the 60s and those who are suffering from disabilities, etc., the rate has increased. And also, there is also a subsidy of $275 for subsidizing our CHD payments or RCHE payments. So this is an increase of 30%. This is a fact. So is this helpful? Well, it may not solve all the problems. However, for some of them who are living in private homes, I'm sure this is quite helpful. We also recognize the contributions of the private RCHDs, but we hope that the private CHDs will develop better so that they can provide quality service. And we will continue to listen to more views, and we'll take these views on board accordingly. Now you talk about a subsidy of $275. Can you double it to about $500? It's less than $2 million, and actually it would help them a lot. I'm talking about 4,000 places, $100,000 per month. You do not need extra funding for this. I'm sure you can do some deployments internally. Well, Chairman, we have been communicating well with the industry, and we understand the operators' difficulties. We want them to provide quality service. So policy-wise, we have already put together many new measures. As for other measures, we are adopting an open attitude. Assistant Director. Now, for private LCHD, 71 of them have obtained a license or a COE, and for among them, 2 provide a low level of care service, and 62 of them provide a medium level of service, and 7 of them provide a high level of service. And 6 out of these 7 are under the BPS. So the BPS is one of our major directions. As the Commissioner pointed out just now, for the next round of BPS, we may increase the percentage of bought places. Mr. Fernando Zhou. Thank you, Chairman. I still have a series of questions. I think today's discussion has not solved the problem concerning the commencement date. 63 of the private LCHDs now have a COE. in the coming 12 or 18 months, how many of them will close down, we really do not know. Well, when these LCHDs close, the inmates would have to move elsewhere, and there is only 1 month's notice. This is relatively short. So in this regard, can the government do something already? Yes, we already have this piece of legislation, but when it comes to the arrangements, can you do better? Because you can only give the inmates 1 month to find a new place in another institution, or they may even have to return home, and that's really too short a time for them to do so. So for the operators, is it very difficult for them to give a longer period of notice? Because by doing so, there can be earlier intervention from the relevant departments. Government officials, Assistant Director. Well, 1 month, that is 30 days, actually is stated in the Code of Practice for LCHDs. And it we say that if an institution is to close, then the operator would have to inform the inmates at least 30 days in advance, or his guardian should be informed. Of course, our position is like this. Well, the earlier the notice, the better, because that will convenience the inmates and his families. So in the Code of Practice, 30 days is the minimum time required. If a 2 months notice can be given, of course, we would welcome that. Well, can the operator also tell us their views? How about those from subvented LCHDs or private LCHDs? Ms. Hui? Was for 30 days. Well, if we are to close, of course, we would know that 30 days, more than 30 days in advance. And, well, some people are lucky. They can find another place in a few days, and they will leave in a few days. And then for the remaining months, we still have to pay our rent, but there's no inmates living there. I think this is reasonable. Well, sometimes when we inform the residents, they would move out immediately, and I cannot ask them to pay for the rent for the remaining 3 months, because I would have to return the premises to the landlord in 3 months, so I still have to pay the rent. So who would think for us? Yes, I understand your concern. I have handled a case like this. That is, there was this NGO. It decided that it would close its LCHD, but the LCHD is going to be run by another NGO. And it issued a written notice to the family members 30 days in advance, and it was during the Chinese New Year. So the family members found it extremely difficult to find a new place for the inmates. So for this NGO, I think it was really irresponsible, although it complied with the law and the COP. I think the government should really think about this. 30 days are really not enough for family members to make another arrangement. And of course, the operators have their points. Now, if they inform the inmates early, then everybody's gone, and they would have to suffer further losses. So can the government consider this? In terms of policy, can you encourage the LCHDs to give an earlier notice? Now you have an FAS for them. So if they are going to terminate their service, can they get some sort of financial support so that when they are closing, the quality of service would not deteriorate? Now, if they are saying that 1/3 of the private RCHDs will be folding, well, you may say that they are bluffing, but there is a certain degree of truth. There will definitely be private RCHDs that are folding. Now, we are told that there will be 5, but let's say there will be 15. Then in the coming months, there will be a number of private RCHDs that are going to close. So how will the government handle this? Assistant Director? Now, if some RCHDs have already made a decision, well, we understand that 5 of the private RCHDs will be closing, then our licensing office inspectors will be monitoring the situation closely. They will keep a close contact with these homes. And we may know this 1 month or more than 1 month earlier. Then we will remind the RCHDs about the requirements in the COP, because they really have to take care of the benefits of the residents. But members can rest assured, when our inspectors know about this, they will monitor the relevant RCHDs very closely. How many more people would still like to speak? Although we still have some time left, but we have to handle the legal issue. Fernando Chang, and who else would like to speak? Jolie, Ms. Kwok, and Mr. Lau. Okay, Ms. Kwok first. Just now we were talking about the closing of RCHDs, and a number of factors were mentioned. For example, the rise in rental and the investment in improvement works, etc. For our inmates, actually there is also a wastage problem. Well, some of our inmates would move to RCHEs. According to the law, RCHDs can only take in 5 elders. But for RCHEs, it seems that there is not such a ceiling for taking in PWDs. And in Hong Kong, we have thousands of RCHEs, so they would charge less so that they can take in more people. So it seems that we are fighting for the same customers. So if all the RCHEs are taking up the PWDs, then I think we are all forced to close. So what is the government's attitude? The government thinks that there are hundreds of RCHEs, so it can just let the RCHDs close. But the elderly and the PWDs have different needs. So will you regulate accordingly? What's the SWD's attitude and direction? Thank you, Ms. Kwok. So we will let the other deputations ask questions first.
Mr. Lau. Thank you, Chairman. I think Dr. Zhang is very familiar with the operation of homes, even private homes. Well, the SWD keeps saying that it's good that we have different types of RCHD. As of course, I might have self-interest because I operate private homes myself, and I Dr. Jiang said, I have accepted many cases rejected by NGOs and some self-financing homes. I think it is better to for homes to specialize so that we will not make things complicated. Sometimes after hospitalization, if a PWD is going to be discharged, we'll receive a call as to whether we're willing to accept it. Private homes are more flexible. Sometimes NGO homes may want to accept them, but they are not allowed to do so because of the relevant provisions. So private homes do have a value. And as Ms. Kwok said, the problem of RCHEs. Perhaps I've digressed a little bit. I like to talk about the aging of inmates. Now, I think the cutoff point should be 60 years old. Somebody who is over 60 years old is an elderly person of an existing person can continue to live here. SWD may ask us to not to accept those who are over 60 years old. Now, I think that, even for the civil service, the trend is to extend the retirement age. A civil servant who is over 60 might be considered for extension of service under some circumstances. Now, because of the aging population, should a person who is 60 years old be regarded as an elderly person? Mr. Lee, to respond to Dr. Fernando Jones' question, you don't have to worry about the capacity of 30. Well, for us in business, we will continue to struggle on until the last minute. You don't have to worry about us. And I think it's all about money, all right? My position is it all depends on the operating cost. Now, for FAS, now, if we can be viable, I don't mind even if they don't give us a cent under the FAS. If I can't operate here, I'll move to another location. There should be no retrogression in the industry so long as we are viable. So this is what we call survival space. I can tell you that the industry is shrinking. The Assistant Director has quoted some figures. On the 18th of November 2011, there were 81 private homes, and now only 71 is left, and 10 have folded up, not the 5 you are thinking about. So there has been shrinkage in the industry. And as the chairman said, we rarely accept PWDs that are severely handicapped. No, this is wrong. We accept a lot of these cases. Cases rejected by NGOs, complicated cases are dumped into private homes. Because for NGOs, they always have a trial period of 1 month. PWDs that do not satisfy the requirements will be kicked out and they are dumped into private homes. There is no other option. And the Assistant Director has told you that among the 71 private homes, how many of them are offering a high level of care? Very, very few of them. We dare not apply for that category because the conditions would even be harsher. If we even can't make 6.5 square meters, how can we achieve 8 square meters? So my internal guidelines for private homes is I will not accept cases that require a high level of care. I will keep our status as private homes for inmates requiring a medium level of care. So let me tell you, in future, there will be no private homes willing to accept severe cases. So it's all about allowance for nursing care. The Commissioner's memory is correct. When we were talking about the figures, we said 1,500, and you talk about 250. So there was a big gap. So if in between there can be a moderate degree of adjustment, I tell you that those 1/3 will not just close. They will just move to better locations, and the whole industry will prosper. Thank you. Assistant Director and Commissioner, Ms. Leung from our team will respond. Thank you. First, whether elderly persons can live in our CHDs. You may recall that in the early stage of legislation, we discussed a specific license for specific RCHS. Well, in fact, the two things are mutually they can be given. The two licenses are mutually exclusive so long as you are able to fulfill the requirements of both categories, then only one license will suffice. So under our CHD ordinance, there is no restriction on private homes accepting those that are over 60 years old. However, when our inspectors visit these RCHDs, they will consider the need of care, and I will see whether the inmates are receiving care they need in the home they are living in. So, so the quota of 5 is wrong. So there is no such requirement or such restriction that an RCHD or RCHD can only accept 5 inmates of another category, right? No. Dr. Zhang and then Mr. Tang, Dr. Fernando Zhang. We have to clarify the facts. Let the two parties clarify first. I have still got 1 or 2 issues to follow up on. So first, the question of 60 years old and the senior social welfare officer has not addressed all the questions raised by the industry, whether the number of private homes is really dwindling. Acceptance of elderly persons by RCHDs. Are you clear? The restriction of 5 is not true. So long as a person is handicapped, even if he is old, we talk about the mutual exemption. Mr. Lau, I beg your pardon, Chairman. My understanding is, now, if that person was accepted before he was 60, it's okay for him to stay on after he has reached 60. But if he is a handicapped person already 60 years old, I think we're not allowed to accept them. So a new inmate. Ms. Leung, can you please clarify? No, the question is not whether he is new to the home. The question is whether the home offers the kind of help needed by that person. If that RCHD provides medium level of care, and if a new inmate is an elderly person requiring a higher level of care, we might have to assess whether that inmate should move to an RCHD that provides a high level of care. So it's not about the age, but the extent of care he needs or his extent of disability. I think Ms. Kwok has pointed out this point. Many inmates of RCHDs have moved to RCHDs. Dr. Zhang said that we should improve our service quality. We do agree. But then our CHE's health workers do not have to take that 16 hours of training on medication and care of PWDs. So if our inmates go to our CHE's, aren't they in a worse off situation? So, Ms. Leung, what do you have to say about this? For health workers, will require health workers to receive training or to be registered separately under the RCHEs and RCHDs. We do have separate requirements for health workers in RCHDs. But I think Ms. Kwok's point is now you're not responsible for RCHEs, but there must be consistency. If RCHEs can accept inmates just on the basis of age, that's okay. But what about those who are over 60 years old with disabilities, including mental health problems? Well, RCHEs will not consider this. It will only admit inmates on the basis of age. Will your inspectors rectify this situation? To ensure that their health workers have received training for looking after PWDs. I think this is our main concern. Do you have such communication? Well, we have very close liaison with the licensing office of RCHEs. For health workers working in RCHDs, they must have that training. Well, that is already clear. But for RCHEs, if they accept elderly persons with disabilities, are the health workers required to receive a training for that? Well, health workers working at RCHEs are registered under that ordinance, so there is no such requirement. So isn't there a loophole here? So inspectors of RCHEs, when they inspect RCHEs, if they see inmates with disabilities, they will advise the inmates to go to stay in an RCHD. I don't think this will resolve the problem. I don't think we can address your concern this morning because they are from different licensing office. Assistant Director, I'm afraid you have to bring this question back to your department. There must be guidelines for operators of RCHEs. If they accept elderly persons with disabilities, then their staff must be trained according to the requirements. You have to rectify this problem. Otherwise, you won't be able to plug this loophole. Have I missed out anything? Mr. Lee? Mr. Lee? What I'm going to say is not directly relevant, but it is a question arising out of this ordinance. Many operators of private homes have voiced their difficulties. I believe they are telling the truth. There will be a spate of closing down on the part of private homes. The administration have to address this problem. They will tell you that there are 2,700 places coming on stream, but compared with the spate of closure we face here, that won't be able to resolve the problem. Yes, I think the government must tackle this problem as a matter of urgency. Dr. Zhang, private RCHEs and private RCHDs. I think there is a problem here. The ordinance will commence operation soon. For RCHDs, if they want to apply for a license offering medium or high or low level of care, I don't think they use the level of care needed by their inmates as a criterion. Rather, that is dictated by the operating costs involved. So I'm afraid in RCHDs offering medium level of care, there are many PWDs that require a high level of care. For the 7 RCHDs that offer higher level of care, perhaps they are able to satisfy the legal requirements, and 6 of them are already under the BPS, so I think they have a better scale of operation. I'm afraid that for homes offering medium level of care, the inmates that really require high level of care do not get the care they need. And in private RCHEs, our understanding is many PWDs are living there. And according to Mr. Leung, the system is very lax. The inspectors go and advise inmates to go to RCHDs well. This is just paying lip service. How will the RCHE drive that inmate away unless it has got a waiting list? But in fact, for RCHEs, the occupancy rate is just 70%.
So I think the government has the responsibility to look at the whole market status, including private RCHEs and RCHDs, and the severity of the disability of their inmates, and find out how much mismatch is there. And I'm also very concerned about PWDs between the age of 6 and 14 who are now living in private RCHDs. Although the number is not big, but I would like to get a figure from the government. I think for both the parents and the public, these are definitely children because they are only 6 to 14 years old. So how come no subvented RCHDs are supporting them? How come they are now living in private RCHDs? I think the government has to look at each and every case and see how these children can be relocated to subvented RCHDs. And what is happening to subvented RCHDs? According to the figures just now, only 2.3% of them can get a license. That's the lowest among all RCHDs. And for private RCHDs, over 10% of them have already got a license. So for subvented RCHDs, only 2.3%. What does it mean? What difficulties are they facing? I think subvented RCHDs should be the first batch who can get a license, because now this piece of legislation has come into operation for 18 months already. Okay, 3 questions. First of all, well, for those who need a high level of care, are some of them now in institutions offering a medium level of care? And how about children between the age of 6 and 14? And how about licensing subvented RCHDs for high to low level of cares? For RCHDs, well, we will have to look at the category of the RCHD. When our inspectors visit the RCHD, we'll look at this. Now, is there such a phenomenon? That is, for RCHDs offering medium to low level of care are PWDs with severe disabilities living in them? Now, if we find such cases, we will ask the RCHDs to apply for a relevant license, or we will tell them that this inmate should not be here. He should be taken care of in another RHD. So you do not have the figure. Maybe you can provide a figure to us later. How about 6 to 14? We do not have the figures concerning these children. But at Mr. Fernando Chang's request, when our inspectors visit such RCHDs and discover these cases, they will have to report back to us. As for subvented RCHDs, 5 of them have got a license. 213 of them are now having a COE. It doesn't mean that subvented RCHDs have a lot of problems concerning building and fire safety. The major reason is that they cannot meet certain conditions. With the advancement of time, we have new fire safety requirements. So these RCHDs would have to meet these latest requirements. For example, visual fire alarm system and barrier-free facilities. And for many subvented RCHDs, they have been operating for quite some time, so they would like to take this opportunity to carry out an overhaul of their facilities. So they need time to do preparations. That's why they still haven't got the license yet. So I would like to clarify this point. It doesn't mean that these subvented RCHDs have huge building or fire safety problems. Mr. Tan Ka-pil. Thank you, Chairman. Well, my concern now is how many of them have overcome the first obstacle and how many of them would get an extension of 12 months. Well, some of them may have to close, but the government should really monitor the situation. And also there are extended discussions. Some RCHEs are taking in elders with disabilities. Those may be physical or mental disabilities. And the private RCHD said this is unfair to them because PWD over the age of 60 cannot be admitted into an RCHD. And RCHDs are divided into 3 categories. Now, for an inmate, maybe is living in an RCHD for quite some time. Originally, his disability is just of medium level, but then he gets more and more serious, and he has to be taken care of by an RCHD, which offers a higher level of care. So this is quite problematic. So these RCHDs are divided into high, medium, low, 3 categories. So maybe the panel and social services would have to look at this. Otherwise, this will become a bigger and bigger problem. Yes, I agree. There are some problems that we discussed today which may not be resolved immediately. And in the future, at different meetings, we can handle them. Assistant Director, I would like to supplement. If it's a mixed residential care home, for example, it takes in PWDs with low, medium, and high level of disabilities, then we do not have limitations concerning the low PWDs with low level of disability. We will just look at the number of PWDs with medium or high level of disabilities. Now, some inmates' conditions may deteriorate, but that doesn't mean that the relevant RCHD would have to apply for another license immediately. But if an RCHD takes care of PWDs with low and medium levels of disability, would have to get a license for medium disability. Well, this is really unclear. Well, if there are a few very serious PWDs in a medium RCHDs, of course, this would be a problem. But your guideline is not clear, and the industry will find it very confusing. I think you really have to look deeper into this. For a person with a medium disability, if he's living in an RCHD and he deteriorates, of course, we can understand that he should be allowed to continue to stay in that RCHD. But if there are many PWDs like that, maybe that RCHD should apply for a new license. So there are a lot of problems. So, Assistant Director, can you draw the line clearer? Yes, Mr. Tang depicted a scenario. That is, originally this RCHD is offering service to medium PWDs, and then one or two of them deteriorates and the disabilities become severe, then the LCHD does not have to apply for a new license, because these inmates have been living there, so we want the LCHD to continue to take care of them. However, if the number of PWDs with severe disabilities increase significantly, then the LCHD would have to apply for a new license, because we have to ensure that the inmates are taken care of in a proper manner. Yes, I think members can understand the Assistant Director's explanation, but we cannot handle this problem, or we cannot resolve this problem today. Now, the government must draw a line. For example, you should state a percentage, then the industry would know what they should do at what time. Because now you don't have a line, so they are really confused. And you're just giving them an advice that they should do this or that. Then the operators are very worried. Yes, I understand that we cannot handle this problem today. One representative still want to say something. I have to handle another item, so I'll give you 1 minute. Yes, I understand that the problems cannot be resolved immediately, but I would like to give you some backgrounds. For children between the age of 6 and 14, we only have 60 special schools in Hong Kong, and most of them do not have dormitories. And we are talking about 8,000 students, so they cannot resolve their accommodation problems. So for the commissioner or the SWD, now you really have to look at the long-term residential needs of these children. Now you may have to change your angle. Now children of 6 years old may have to go to LCHD. I think they have been forgotten by the government. So you really should look at this problem. I understand that we are not discussing this today, but this is what I want to remind you of. Okay, we have talked for about 3 hours, and that's an important item that I need to handle, because we have to scrutinize the residential care homes persons with disabilities ordinance commencement notice. I would have to read it out and see if members have problems. Under section 1(2) of the residential care homes persons with disabilities ordinance cap 613, I appoint 10 June 2013 as the day on which part 2 of the ordinance comes into operation. Members, do you have any questions? If not, then we will pass this. And I would like to remind members that actually we have all expressed our views today. Although there are some problems remain unanswered, but we have put these questions forward, and we hope that the government would follow up on them. The industry thinks that a number of LCHDs will fold, and I hope the government can monitor this very closely. In 12 or 18 months' time, we may see this happen. So I think you should deploy more staff to help the displaced inmates. On the 9th of May, we have assigned a time slot for another meeting. So do we need to hold this meeting? Mr. Fernando Zhang, no, I don't think there is such a need, because we have passed the notice today. And we do not object to the commencement date of part 2. However, after today's discussion, there are still a lot of problems. The stakeholders have different problems. Yes, we have the same direction. That is, a higher quality service should be provided to PWDs. I hope the government would have the commitment and it should continue to communicate with the stakeholders. And I hope that before they come to the LegCo, most of the problems would have been resolved. Now we have a social welfare panel, and we also have a long-term care subcommittee, so they would monitor the situation very closely. So if there's any progress, you should come to report to us. Or if there are any new questions for discussion, please take the initiative to come to us. So I'd like to thank the deputations and individuals for attending today's hearing. Thank you. We'll adjourn the meeting now.